Hi, my name is Grismel and this is the chapter 15. Blood. A. Full blood account. In the investigation of blood disease, the sample test is a full blood account. FBC. A full blood count measures the following in the sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocytes sedimentation rate, ESR, the measurement of how quickly red blood cells fall to the bottom of the sample of blood. B. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking of deficits in iron, Fe. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor and a student. What's the most likely diagnosis in this case? Most probably carcinoma of the bowel with chronic blood loss. What's against that diagnosis? Well, he hasn't had any change in his bowel habit or lost weight. What else would you include in the differential diagnosis of severe anemia in a man of this age? He may have leukemia of some sort of aplastic anemia, but that's rare. It would be very unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Okay, now there's another cause of anemia which I think is more likely. Chronic bleeding ulcer? Yes, that's right. But what about pernicious anemia? Can you exclude that? Well, he's got none of the typical neurological symptoms like paresthesias. Pernicious anemia. Jordi Pons, the medical student for Barcelona, has made some language notes in these textbooks. Pernicious anemia, PA, is a condition in which there is an atrophy of the gastric mucosas with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressive increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and milk urines caused by excessive breakdown of the hemoglobin because of ineffective red cell production in the bone marrow. A red cell tone glossitis is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive meekness and atrasia. The spleen may be palpable. Onset, beginning, insidious, slowly developing, pallor, lack of color, meal, slim, germs, bilirubin, mania, breakdown, division into swallower parts, bone marrow, soft ensures in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continuing to develop, palpate, can be felt with the hand. I traducing the chapter 15 in Spanish. Sangre, un hemograma completo. En la investigación de enfermedades de la sangre, la prueba más simple es un conteo sanguíneo completo, FBC. El hemograma mide lo siguiente en una muestra de sangre: la cantidad de hemoglobina, el número de las diferentes células, glóbulos rojos, eritrocitos, glóbulos blancos, leucocitos y plaquetas, trombocitos, el volumen de las células, la tasa de sedimentación de eritrocitos, ESR, una medida de la rapidez con lo que los glóbulos rojos caen al fondo de nuestra sangre. Anemia. La anemia es una de las enfermedades más comunes de la sangre. Puede deberse a sangrado, pérdida de sangre, destrucción excesiva de glóbulos rojos, baja producción, por ejemplo, que la dieta es deficiente o carece de hierro. De hierro. Un estudiante ha examinado a un paciente anciano con un nivel muy bajo de hemoglobina y está discutiendo el caso con su profesor. Profesor, ¿cuál es el diagnóstico más probable en este caso? Alumno: muy probable carcinoma del intestino con pérdida crónica de sangre. ¿Qué hay en contra de eso como diagnóstico? Bueno, no ha tenido ningún cambio en su hábito intestinal ni ha perdido peso. ¿Qué más incluiría en el diagnóstico diferencial para anemia severa en un hombre de esta edad? Podría tener algún tipo de leucemia o anemia aplásica, pero eso es raro. Sería muy inusual. Otra causa es inferencia de hierro, pero a veces tener una dieta adecuada. Pero parece tener una dieta adecuada. Está bien. Ahora, hay otra causa de anemia que creo que es más probable: úlcera sangrante crónica. Sí, así es. Pero, ¿qué pasa con la anemia pericosa? ¿Puede excluir eso? Bueno, no tiene ninguno de los típicos síntomas neurológicos como parestencias. Anemia pericosa. Jordi Pons es un estudiante de medicina de Barcelona. Ha hecho unos apuntes de lengua en su libro de texto. La anemia pericosa, AP, es una condición en la cual hay atrofia de la mucosa gástrica, con el siguiente intrínseco de lento desarrollo, insidioso y mala absorción de vitamina B12. El inicio es insidioso con aumento progresivo de síntomas de anemia. A veces se dice que los pacientes tienen un color amarillo limón debido a una combinación de palidez e ictericia leve causada por una descomposición excesiva de hemoglobina debido a la producción eficaz de glóbulos rojos en la médula ósea. A veces se presenta una lengua dolorida, glotisis. Los pacientes presentan parestesias simétricas en los dedos de las manos y los pies, pérdida temprana en el sentido de la vibración y debilidad y axia progresiva. El brazo puede ser palpable. Comienzo, fracaso de la producción de factor, palidez, falta de color, ictericia, bilirrubina, descomposición, división de partes más pequeñas, médula ósea, tejido blando en la cavidad de los huesos, simétrico, cada lado del mismo, sentido de vibración, capacidad de sentir vibraciones, progresiva, continua, desarrollándose, palpable, se puede sentir con las manos. This is the exercise of the chapter 15. 15.1. Find words in the textbook with opposite meanings. Look at B and C opposite to help you. Adequate with inadequate. Against with for. Unlikely with likely. Sever with meal. Rate with common. Sudden with insidious. 15.2. Make word combination using a word from each box. Look at B and C opposite to help you. Bond, differential, insidious, iron, pernicious, progressively, vibration, diagnosis, sense, onset, marrow, increasing, differency, anemia. Differential diagnosis, bone marrow, vibration sense, pernicious anemia, iron deficiency, progressively increasing, insidious onset. Complete the 15.3. Complete the sentence. Look at A, B, and C opposite to help you. 39 years old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by vitamin A deficiency. 3. The bleeding and purpura and caused by abnormal pipette function. 4. The white cells count is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctive is probably due to germs. 6. There are a papal mass in the right upper quadrant of the abdomen. 7. Treatment is admitted at restoring include balance with adequate intravenous fluid. 8. The anemia may be due to increased red cells breakdown. 15.4. Complete the conversation. Look at C opposite to help you. Professor, what is against diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin failure, and B doesn't have a symmetrical parastenesis of asset, vibration sense, and I could feel his spleen. What about his tongue? His tongue is normal and not inflamed or sore.